Electronic Health Record and Health Information Exchange, A Journey to Making Your Experience the Best by Trecia M. Wilson. Chance Primary Care Clinic is a nonprofit healthcare clinic that provides primary care services to patients over 18 years old. The Affordable Care Act required healthcare organizations and physicians to change their healthcare practices financially, technologically, and clinically. As a result, Chance Primary Care Clinic has fulfilled the meaningful use guidelines of the Affordable Care Act and implemented an electronic health record system that connects to a health information exchange system. This presentation will help you explore the new benefits you will receive as a patient or caregiver. An electronic health record is sometimes called an electronic medical record. It is a collection of a patient's health information that is stored on a computer. Let's make this easy. The picture on your left is your paper medical records. The pictures on the right are some of the different electronic devices that will be used to store your medical information. What does this mean? This means when you visit Chance Primary Care Clinic, your doctor may view the information in your medical records from a desktop computer, laptop, or a tablet such as an iPad. Paper medical records will no longer be used. With electronic health information exchange, you, your provider, nurse, pharmacist, and other healthcare providers can access your information. Health information exchange also allows healthcare workers to securely share your pertinent health information. Okay, I know you're asking, how does this benefit you? Electronic health information exchange improves patient safety, increase efficiency, contains support tools for patients and caregivers, decrease cost, eliminates unnecessary testing, reduce health-related costs, improves the patient experience. Do you ever feel like you are all over the place when you visit the clinic? Have you ever had to wait for orders to be faxed to the lab or x-ray? I know, as a patient, a clinic visit can sometimes be stressful. Let's take a tour with Mr. Whitaker to see what your new experience would be like. Mr. Whitaker calls the clinic with complaints of coughing up green mucus, chest pain while coughing, and a low-grade temperature for 2 days. The nurse tells Mr. Whitaker she scheduled him an appointment to see his doctor at 10 a.m., but prior to his visit, she would like him to stop by lab to have some blood drawn and by radiology to get a chest x-ray. Let's compare your past experience with your future experience. In the past, orders were faxed. Radiology and lab may not receive the orders. Mr. Whitaker has to wait until the orders are received. Mr. Whitaker is not happy. In the future, Mr. Whitaker arrives for his appointment. No delay or extended wait times. The lab and x-rays are done. Mr. Whitaker is happy. Mr. Whitaker arrives at the clinic for his appointment. The nurse calls him back, places him in a room, takes his vital signs. The doctor enters the room with his tablet that has Mr. Whitaker's lab and x-ray results. The doctor tells Mr. Whitaker he has pneumonia and will be placed on antibiotic therapy. Prior to leaving the office, the nurse tells Mr. Whitaker his prescriptions for antibiotics were electronic prescribed. Mr. Whitaker did not understand, so she explained to him that with e-prescribing, the doctor can electronically send his prescriptions to his pharmacy. Now let's compare the past and the future and possible outcomes. In the past, test results were not seen immediately. Delayed inappropriate treatment. In the future, Test results are seen immediately, and treatment is not delayed and is appropriate. Electronic prescription. Now let's talk about the pros and cons. Paper prescriptions can sometimes be inaccurate, not understandable, places the patient at risk for medication errors, hospitalization, and possibly death. Electronic prescriptions are accurate, they are error-free, understandable, safe, prevents medication errors. Later that evening, Mr. Whitaker receives a call from his daughter. He informs her of his visit to the doctor but cannot recall why the doctor ordered antibiotics. Mr. Whitaker's daughter logs into the patient portal and learns that Mr. Whitaker has pneumonia. Mr. Whitaker can also use the patient portal to review Mr. Whitaker's medical bills, obtain education information about pneumonia, and request prescription refills, get alerts for changes to records, get reminders, view and request appointments, update personal information, review your results, securely message your provider. 2 days later, Mr. Whitaker visits his pulmonologist for a regular scheduled visit. He tells the provider about his visit to his primary care physician. Since the doctor's office has an electronic health record connected to Health Information Exchange, he can review Mr. Whitaker's lab results and information related to his visit to Chance Primary Care Clinic. Upon reviewing the labs, he saw that the blood culture results were completed and informed Mr. Whitaker that he would be admitted to the hospital. Upon arrival to the hospital, Mr. Whitaker's health information was accessible to those who were involved in his care. 2 days later, Mr. Whitaker was discharged home. At Chance Primary Care Clinic, we aim to make the patient experience the best.